Hello, what I do on healthcare is I would make it a tax for those who don't have healthcare. That way you could keep a competitive market, a free market, which is you know, uh, a more advanced market and a higher quality market. So what I do is I'd make it a tax for the people who did not have it. This way they could cover their cost in mass, like an insurance program, but they pay for it out of pocket, just like that. Taxes, when you pay your taxes, there you go. Here's this part is set aside for your medical costs, even if you don't have any. You know, to to the to the need that we can do now. As to the need that we can do, how cool would it be if we could offer more? Well, uh, uh, let me finish first for the Medicare on for indigent people, people who are homeless or people who don't do, or have chronic unemployment, um, or are unemployed, uh, for the tax season that the period of their sickness. You would just attach that tax bill to their bill. You know, you provide them the highest quality of service you would anybody. Okay, their ability to shop is the same. Um, Now it's up to the provider whether or not they take them on, but it really it can be anonymous even uh, because everybody should have you know uh, uh, good care. Um, but I know money comes into it, and it's like, okay, this hospital's for the poor people. And then you have the mentality of poor. Now you have the Hippocratic Oath, which is to take care of that. Um, but the way that just human nature is that we don't always follow our oaths. And it's it can get complicated. So what I would do is I would make the same way you have doctor-patient confidentiality that provides a sense of relief in terms of those worries. I'd have provider doctor confidentiality, so that you wouldn't know. As a doctor, you would treat each person as if they were Bill Gates, or whoever. You just you know that would be kind of a fair thing to do to make quality higher. And so you would attach the bill to the indigent person, so that anytime he worked, he would be paying his tax bill. And that'd be a more efficient way, because you could keep your free market without super government intrusion, a pile of paper this big and all kinds of stupid stuff. Or and you could tax those who, it's still a tax, it's a tax, no. But so that's what I do for healthcare. And in terms of taxing, I still have to. I want to mention that on taxing, what would be a good tax rate? What would be a good tax rate? Where could we get information on a good tax rate? What have we seen that works in taxes?